Let's see this. Okay. You're going to see my pop-ups whenever somebody comes in. I don't know how to change that off of that screen. Um, so we are going to talk a little bit about the history of it. We're also going to talk about how the uh, our our Nurse Practice Act here in Ohio impacts patient use of it, including patients who are nurses. And then we're going to talk a little bit about how it impacts advanced practice providers, our APNs, prescribing medical cannabis. So preview of that, they can't. Um, and then we're going to talk about some federal legislation that impacts the use of therapeutic cannabis, both inside and outside our Ohio healthcare facilities, and why there's still some really murky areas where we don't know what the answer is going to be. All right. So the history of therapeutic cannabinoid use here. This actually started back in China in 2700 BC. So I kind of thought this timeline was cool. It stopped about 10 years ago, so it doesn't have the most recent things, but it does show you there that we do see it in we did see it way back in China. Like 5 centuries ago, and it has continued through history that we have used cannabis as a medical treatment. And so it's not a new thing. It is not a new thing at all. And we will talk about the history of it in this country. So the father of Chinese medicine, way back 2700 BC, it was called Ma at the time. And you'll recognize the um, afflictions that it was used to treat. So, rheumatism, which is the old word for rheumatoid arthritis, we used it to treat gout, malaria, which is interesting, constipation, and memory problems. And my question with that was maybe that was Alzheimer's, maybe that's what we were using it to treat then. But I mean, it was part of Chinese healthcare. And also in India. And if there it was used for its pain relieving properties, its anticonvulsant properties, anti-inflammatory properties. It was called banga. And it was and is often consumed in drinks during both religious and healing rituals. So we do see it even today in India, this banga. So, moving backwards a little bit in Egypt, I don't know why I had those out of order, but it was called Shemshemet there, and it was used to treat inflammation and glaucoma. So, if you're sensing a theme here, it's the kind of things that we use it for now, right? We use it for pain, we use it for any kind of inflammatory processes. We know that it works for that, right? And it wasn't really a new discovery. We definitely did not discover it here in Western medicine. Um, Islamic medicine, anywhere from 1300 to 1800, they include cannabis in their medical texts. And it was used to treat epilepsy, pain, and nausea. Three things that we still use it for today. So, now, following the teachings of Islam, there are prohibitions on intoxicants, but they were okay if they were used for medicinal use. And so that actually made this okay. And so they did use it frequently for those afflictions, for those diseases. And then we're up in the medieval times, and it was used medicinally across Europe. It was put in tinctures. It was put on poultices. That's the first time that we heard that. And it's not generally, doesn't generally work topically, but they used it to treat tumors and coughs and jaundice. So those were new uses for that back in the medieval times. And then finally, we see the rise of Western medical use, and this started in the 19th century. So it was actually an Irish physician. His name was William Brooke O'Shaughnessy, and he actually got it from India and brought it over to European medicine. Um, it was the same kind of indications here. So we used it for pain relief, we used it for muscle spasms, seizures, sleep disorders. So we really were following Chinese medicine. And one fun fact is that it was listed in the United States Pharmacopoeia, so the USP, for about 100 years, from 1851 till 1942. It was a prescribed medication. So then what happened? Um, in the early 1900s, there were some concerns about recreational use and also racialized propaganda, especially in the US. And so they started to regulate a little bit more. In 1937, that was when the Marijuana Tax Act, that's not a typo, that is how it used to be spelled. The Marijuana Tax Act was enacted, and basically that put a ton of taxes on marijuana. And that really sharply reduced the medical use of it. It also criminalized it for recreational use. So now we're talking about while it was still in the USP and could be prescribed, it was so prohibitively expensive because of the taxes on it, that it wasn't used. Between the 1940s and the 1970s, so in that area, it was removed from the USP and then later was classified as a Schedule 1 drug under the 1970 Controlled Substances Act. And Schedule 1 drugs are the ones that have no accepted medical use. So we know that they do, though, right? And so since then, 1970s to 1980s, it was federally prohibited. But we continued to do studies and we continued to get anecdotal evidence from people about its benefits in nausea, especially that related to cancer. And if you know anything about the use of marijuana to treat nausea, we do know that it is very, very effective in curbing that chemotherapy-induced nausea and vomiting. So we knew it helps with that. It also actually helps decrease the pressure in the eyes. So we see it working with glaucoma, and it definitely also helps with chronic pain. So we were seeing anecdotal evidence, right? And people were doing studies based on this anecdotal evidence. And then 1996, of course, it was California, right? But California is the first US state to actually legalize it for medical purposes. And so that was 30 years ago. And now many, many states have legalized medical cannabis. So starting after California, our basic, I've got a list of some of these. This is not all, but we do have medical cannabis that is legal in a lot of states for things such as chronic pain, for epilepsy. So CBD is used for chronic seizures that are we're talking about people who have just hundreds of seizures a day. And just, they're very small, but hundreds of seizures a day, regardless of how small they are, is very serious, obviously. Um, we know that it can be used to help PTS. We know that it can be used to help MS, the chemo-induced nausea that I was talking about earlier, and then also anxiety and sleep disorders. So that's a bit of the history. And so we all know, we've all watched the news and we've seen that there really is a lot of information out there, and it's very it is moving through different states and the federal government. There's a lot of new there's not a lot of new bills that have been introduced. We're going to talk about some of those, including what happens here in Ohio. Okay, so when we look at the Ohio Nurse Practice Act, and this is the law piece of it, and how that interplays with the fact that marijuana for recreational use and medical use, you can have a marijuana card, a medical marijuana card. So how does that impact us as nurses? We're going to talk about that. We're also going to talk, because I know a lot of people here are faculty in some way, and how does it affect our students? So we're gonna talk about all of those and the interplay of the Nurse Practice Act there. Okay. All right. So, um, The Ohio Administrative Code. So, the nurse, just a little background on the Nurse Practice Act. The Nurse Practice Act is in two pieces. Okay. Within the Ohio Revised Code, that's the law. Okay. And basically, what the law says is it creates the Board of Nursing and it gives the Board of Nursing the power to enforce the Nurse Practice Act. Okay. All of the rules are under the Ohio Administrative Code. So when you see OAC, that is the Ohio Administrative Code. So those of us who look a lot at the law and the rules are very comfortable with Section 4723 of the Ohio Administrative Code because that dictates exactly what we can and can't do. So basically, this section of it requires the RN to demonstrate competence and accountability in all areas of practice in which the nurse is engaged, including consistent performance of all aspects of nursing care and recognition, referral or consultation, and intervention when a complication arises. That's really generic, right? But the question is, now that we know that medical marijuana is, it's absolutely, we're going to have patients with it, right? And some of those patients may be your patients. And so this right here, this provision of the Nurse Practice Act requires us to understand what that medical marijuana, its uses, how it's going to work, what kind of effects it's going to have on our patients, but also complications, and what we might see. So those are things that we really need to pay attention to, even though it's still illegal federally. So we do have we are required. So this is a list of the approved medical conditions in Ohio, and you can see that there's a ton here, right? And so they kind of fall into a few categories here. Obviously, things that cause pain, and we have pretty high quality evidence that marijuana is effective for pain. It is effective for cachexia, that's the skin and bones from cancer and other diseases. It's effective for chemo, for the chemotherapy-induced nausea and vomiting, or CINV. It's very effective from that. The pain that it is affected for is both chronic and acute pain. So things like rheumatoid arthritis that has acute pain episodes, chronic pain for diseases such as fibromyalgia, neuropathies from diabetes. And also spasticity. So that's where like MS comes in, Parkinson's, some of our CTEs, our epilepsy. We know that we actually have pretty high quality evidence that is talking about that. So, who can prescribe it? And the short answer to that is not an NP. So, our advanced practice nurses here in Ohio are not permitted to prescribe right now. And that is a combination of a couple of different pieces of the Nurse Practice Act, but also the Medical Practice Act. Okay, the rules of medicine in Ohio. So under the Ohio Administrative Code, and I'm not going to read all the section numbers, but it does have what we call an exclusionary formulary. So an APRN can prescribe certain things, but it's very specific here that they shall not prescribe or furnish. That means actually supplying it. So this would be like a nurse practitioner running a dispensary, for example. Shall not prescribe or furnish any drug or device in violation of federal or Ohio law, or rules adopted by this board. And so right now, medical marijuana is illegal federal, or marijuana in general is illegal federally. And so this prohibits any nurse practitioner from prescribing it. Now, as we look ahead, it probably is going to become legal at the federal level soon. I do predict that will happen. There are a couple of bills that have been introduced in our federal legislature that I'll give you just kind of the intro to those. They haven't moved anywhere for a couple of months, but also it's summer. So, but things may start to move once, in the fall, things may start to move on them. So, but we'll talk about those. So, in Ohio, we have something called the CTR, and this is actually for your this is from the medical board. Okay, so you'll notice that it's not 4723 anymore; it's 4731, and this is how practitioners, physicians, okay, um, it can recommend medical marijuana. Okay. It's a certificate to recommend. And in order to be eligible to dispense these certificates, the applicant must hold an active, unrestricted license to practice medicine. So it's very clear. The medical board is very clear in stating this is only, this is only somebody who's certified as a MD or a DO. Okay, but they have a license to practice medicine in Ohio. And also, they have completed 2 hours of continuing medical education. That's all, just 2 hours. So I thought that was kind of an interesting piece. The rest of it isn't really, and that medical education has to be over diagnosing those qualifying conditions and treating them. And basically, they have 2 hour courses that are available to any physicians that want to get a CTR. And if you search CTRs in Ohio, and this is this little picture here, this is where they are. So we've got them kind of scattered around Ohio. You can see them kind of concentrated in the larger cities there. So we've got a concentration around Cincinnati, around Columbus, around Cleveland, where you've got several, and then you've got kind of some scattered here. But these are physicians with a CTR, so that's where we can find them. Now, things that are coming up in Ohio. So this is actually it's currently in the it's in process in the Ohio legislature. So when they did legalize cannabis in Ohio, there were certain pieces of the law. And we're only focusing really on the medical side, but some of the things that are coming up have to do with the recreational piece. So they are reducing the maximum amount of THC in it from 90% to 70%. And we're limiting the content for edibles now, to so you can't buy in bulk, basically. And we are also reducing the maximum number of homegrown marijuana plants in a single residence from 12 to 6. Um, Prohibiting any non-sanctioned transfer of cannabis between two people. So, grandson cannot buy it for grandpa, basically. So regardless of age, is that piece, because it was when they were talking about adding this was, what about people who buy it for their aging parents, for example? So, recreational marijuana has to be stored in its original packaging. I wasn't real sure about what original packaging was for marijuana. Is that like the actual leaf? But prohibiting possession of marijuana purchased out of state. So you have to have purchased it in Ohio if you're in Ohio. So, um, this one caused a lot of discussion here. The original law, issue two, it did start a cannabis social equity and jobs program, which basically provided financial support for people to start dispensaries, to people that were adversely impacted by the enforcement of laws. Of marijuana related laws. So we are looking, and so they were helping people who might not have otherwise had the money to do it. And then finally, something that did get a lot of support was the expungement of marijuana related convictions from before it was made legal. So if you had a conviction from before it was made legal, this now allows that conviction to be expunged. Okay. So, what does all this tell me? Because this is a lot about recreational marijuana, right? Basically, what this is it's answering this question, will I see patients who use it? Absolutely. You'll absolutely see patients who use both medical and recreational marijuana. But probably not in hospitals. Not as something you are going to be helping to prescribe. Why? Now, I'm not saying that patients can't bring it in, because they absolutely can and they absolutely will. Okay, we will see that, just like we know that patients bring other controlled substances in. Why is it not going to be a thing in hospitals, at least anytime soon? Because hospitals get federal funding. Hospitals are funded through CMS. And so when we are talking about the hospitals in Ohio, they will not be able to get federal funding if they allow patients to have medical marijuana in their facilities. So it is also against hospital policy at several major health systems in Ohio, including UC. By the way, I did look that up. Now, exceptions to this. In a hospice, it's probably okay. And quite frankly, that's because nobody wants to tell a dying person that they can't have it, even though they still get federal funding. I think that's going to be a situation where we look the other way. I really do think that that's going to be that situation, and that is that situation. If you kind of get some anecdotal evidence, nothing, of course, is in writing about this. Some other exceptions. There is a lot of research into it and what it can do, including research through UC Health, for example. And some of that research is federally funded, which kind of makes you think, because if it's illegal federally, how are we federally funding research into it? And those patients can use it. So there are active medical research studies over through UC Health, for example, where patients are using medical marijuana. Okay, and those are sometimes federally funded research, and so we are absolutely allowing that within those studies. Okay. So, what do you need to know? And I go back to that piece of the Nurse Practice Act, okay, which is where we have to demonstrate competence and accountability in all areas of practice, which does include taking care of patients who may be using marijuana either for a recreational use or a medical use, okay? So we have to know about it. And so now we're going to talk about it. So there's a couple different types. Cannabis sativa, and cannabis indica. Okay, so these are two real different, very different strains. Okay, and what we see in our dispensaries, for example, are hybrids that have different percentages of the main types. Okay. Now, cannabis sativa is more energizing, and cannabis indica is less energizing. Okay. And so they will have different percentages of each one. Also, when within each strain, we will see various percentages of THC and CBD. Now, CBD is not regulated. Okay. So THC is the component that does cause the effects, right? Now there are benefits of CBD, and but CBD is legal, and so that's not really what we're talking about here. So I like this little infographic that I found about sativa versus indica, and it talks about what they look like first of all. So the leaf actually looks a little bit different. And again, sativa here, this is our energizing. Okay, so it causes a euphoria. It causes more mental alertness, more creativity. It gives you more energy. It gives you more energy. Whereas indica, this is relaxation. This is also the one that stimulates the appetite. And this is the kind that we use for sleep, and we use it for pain relief, and we use it for anxiety. Okay. So you will see different strains that are different percentages of each. Okay. But in general, your sativa strains are going to be better for daytime use, and your indica strains, these are more the ones we're going to see for medical marijuana. Okay, so you're going to be seeing patients that the different combos and there are just a ton of different combos. Okay, with different percentages, because you've basically got four things, because you got your THC, your CBD, and then which type it is in each different blend that they are making, in each strain that they cultivate. So, but most of the medical indications are going to be under indica. So, side effects. So these are going to depend on their underlying condition and the other medications that they're on. So as nurses, we really do because pharmacists are not going to check for interactions with marijuana. And I know one of the things that I always teach my students is that you have to know everything that your patient is taking. I don't care if it's, illegal. I don't care if it's what they consider a supplement, if they whether it's an herb. A lot of patients won't mention the fact that they take garlic pills because it's garlic, right? And so that's in my food. Why would I need to tell my nurse that I take garlic pills? Okay. And the reason you need to tell your nurse if you take garlic pills is because it's actually an antioxidant. So that's kind of an interesting thing, and it will interact with some of your anticoagulants. But pharmacists aren't checking, which means we need to know what kinds of effects we're going to see in our patients, because that is part of being a nurse, and that's part of following our Nurse Practice Act, right? So in general, we will see an increased heart rate, especially in the sativa kind. Increased appetite, which remember sometimes the goal, right? That's what we're looking for in patients who are taking it for chemo-induced nausea, vomiting, for example. Sleepiness and dizziness. So this is CNS depression, right? You've got a patient that you didn't realize had some edibles in their drawer, and then they're used to, eating a brownie or a gummy every night before they go to bed, and then you have something to help them sleep as well. So you really got to watch the combo of those. Can cause hypotension. It does dry mouth, dry eyes, decreased urination. It does have some anticholinergic effects there. Can cause hallucinations, paranoia, and anxiety. That's kind of your sativa. Okay. And then on the other side, impaired attention, memory, and psychomotor performance, and that's more of the indica. So again, like looking at the strains, and your patient may or may not know the strain. They may just know, well, this is supposed to be helping me sleep, for example, or this particular one is supposed to be helping me to get calmed down because I have anxiety, or I'm taking this for pain, for example. So again, most of our medical marijuana will be high on the indica type there. And so just to flip back here, remember this is the indica type here. So relaxation, sleep aid, pain relief, and stimulation of the appetite. That's what we're going to see there. So if your patient is using it um, for pain or one of those other conditions. Okay. So here's some other stuff to be aware of, though, if your patient is doing it. So, if they are smoking it can actually cause asthma exacerbations and COPD exacerbations. However, cannabis itself is a bronchodilator. So that's kind of an interesting piece for our patients who have COPD, as long as they don't smoke it. So that's the thing, right? It has to be in the form of an edible in order for it to really have that impact, because the act of smoking it, of inhaling it into your lungs, is going to trigger just like our cough reflexes and things like that. So, heart conditions. Our sativa, because it is a stimulant, may exacerbate coronary artery disease. It can exacerbate heart failure. Now, any of them can cause hypotension if used in excess. And so we do have to watch that, because if your patient's already on blood pressure medicine, for example, you may see a marked drop in blood pressure that you weren't expecting, and it's because they just had a gummy. Okay. Dyskinetic disorders. Okay. Sativa is going to make those worse. It's absolutely going to make that worse. So if when we're talking about, for example, Parkinson's, okay. Parkinson's has periods of on time and off time with Parkinson's meds. And when they're in an off time and they're moving very, very, very slowly, sativa could indeed work. However, if they're in an on time with their meds and they already have dyskinesias from the side effects, then it's going to be a lot worse. Okay. Um, we know that although it's not it absolutely can cause dependency. It can also exacerbate other dependencies. So dependencies on alcohol and drugs. It can cause greater cognitive impairment for people with neuro disorders, and it can make psychiatric conditions worse. Okay, so by causing hallucinations, paranoia, and even suicidal ideation. So we do have a medical condition. We call it cannabis use disorder. And this is a problematic pattern of cannabis use that leads to significant impairment or distress. Okay. Some kind of physical condition. This is much more likely with recreational marijuana than medical uses. However, even if you use a smaller amount for medical uses, withdrawal can happen even for those small amounts. If you have daily or almost daily for a few months, you will absolutely have withdrawal symptoms if you stop suddenly. So initially, they will have insomnia, loss of appetite. They will have some physical symptoms, such as heart rate elevation. They'll have restlessness. Okay. And this is all withdrawal from it. So if you've got somebody who has been a regular medical cannabis user, can't get it in the hospital, then they will, and they've been using it for a while, they're absolutely going to go into withdrawal. And so we need to be really aware of those side effects, right? Of those withdrawal effects. After about a week, they're going to have mood changes, and they may have very vivid and unpleasant dreams. Once they get past that stage, they're usually they then it comes down pretty quickly. Withdrawal from cannabis is not going to be lethal. So that is it, but it is definitely going to be uncomfortable for the patient. Absolutely. So how much are they going to use? So how much will we see our patients who do have a card? How much are they going to use? Okay, and it really depends. And so looking ahead to when cannabis is most likely going to be legalized federally, eventually, and most people really do think that eventually it will be legal federally. But since it's not an FDA drug right now, there's no recommended dosage. Okay. And so in general, people who are getting a prescription or a card for medical cannabis, they don't know how much to use. So if you work in areas where you do have patients who get a medical card, it really, once we find out, we do need to make sure that they are getting good advice about it. So start low, go slow. That's kind of the general rule here. And they should keep a symptom diary. Track how much they're using, their symptoms, what kind of relief they've had, and then any kind of adverse effects that they had. So encourage them to keep track of that. Just like any new medication, right? We want to follow up on it. And again, this is because, are we going to see patients using it? Yeah, we absolutely are. It's gonna happen. So, all right. So switching a little bit here, what if you, as the nurse, have a medical card? So that's become a question: is can I have a medical card and work in a hospital in Ohio? The answer is probably not. So many of our hospital systems, even actually nationwide, because I did look into this in other states that have legalized marijuana, not just Ohio, the vast majority of hospital systems will still test for this on drug tests. Okay. And the use of marijuana even medical use of marijuana is against policy at a lot of our major institutions. So I included Capital because they did this talk at Capital University. But at OSU, for example, you cannot use marijuana on campus. And Ohio State's hospital, the OSU hospital, it's against hospital policy there as well. It's against policy here at UC. So both the university, you're not allowed to use marijuana, even medical marijuana, at the university, and it's also prohibited at UC Health at the hospital. Um, So, unfortunately, even if you have a card for it, the rules about our federally illegal substances, I mean, we're still breaking federal law. So, federally, marijuana is the same as heroin. And so, hospitals aren't going to risk their federal funding, not for somebody who's replaceable, right? Not for a nurse. And so it's interesting because you're like, oh, marijuana is not heroin, but it is federally. It is in the exact same category as heroin, and it's a question of would I want a nurse, taking care of me who uses heroin, and we're all, everybody's like, oh, no, I wouldn't want a nurse taking care of me who uses heroin. What about your nurse who has a medical marijuana card? Well, that's kind of different, right? You kind of, you might have a different feeling about that. Um, but it's the same federally. So we do have to keep that in mind. What's the Board of Nursing say? Nothing. That's what the Board of Nursing says. Um, but nurses have been disciplined by the Ohio Board of Nursing for testing positive for marijuana, regardless of it being legal under state law or if they got it in another jurisdiction and used it in another jurisdiction. And it's still illegal federally. So, and is the use of marijuana putting patient safety at risk? Because that's where we're going. That's where we're going, right? With when we're looking at the Nurse Practice Act, is we're looking at patient safety. So, Ohio law right now doesn't require employers to allow it in the workplace, which means that our hospitals, even though Ohio has said that marijuana is, we've got laws now, right? It's fine. Um, but Ohio law doesn't even require a Ohio business to allow medical marijuana. They don't have to. They can still enforce drug-free workplace policies and take actions against employees who violate them, even if they are a registered medical marijuana patient. So our main concern here is patient safety and the nurse's ability to perform their duties safely and effectively. Okay. And if that medical marijuana impairs their ability to practice or puts patient safety at risk, then we will take disciplinary action in the state of Ohio. Okay. So what's that look like? And the actual OBN piece here. So it's under Ohio Revised Code 4723.28B. Okay. And the OBN can discipline you for habitual or excessive use of controlled substances, other habit forming drugs. So that would be like prescription medications, right? Or marijuana, since it's not a controlled substance, it's kind of in a weird category, right? Or alcohol or other chemical substances to an extent that it impairs the individual's ability to provide safe nursing care or safe dialysis care, because the Board of Nursing also regulates dialysis technicians. And it can discipline you for impairment of the ability to practice according to acceptable and prevailing standards of safe nursing care or safe dialysis care because of the use of drugs, alcohol, or other chemical substances. Okay, so OBN absolutely has the right to discipline you, even if you have a medical card, even if you have a medical marijuana card. They absolutely have the right to discipline you if that use of medical marijuana is found to affect you. Now, would we, go to the hospital on would we, have a few drinks and then go work our shift? I hope that everybody would say no. Have nurses been disciplined for that? Yes, absolutely. Would If we've got somebody who takes prescription medication for chronic pain, let's say they take something that isn't necessarily mood altering, so we're not talking about like Percocet here, but something like gabapentin for chronic pain, and that they take and they work their job at it. Sure, that's fine, right? But that's why they take the medical marijuana. But the issue there is that if it is impairing your ability to provide safe nursing care, then you can be disciplined. Okay. Student nurses, since we are, a lot of us are faculty here. So this is part of the administrative code. So we're talking about the rules. And a student shall not habitually or excessively use controlled substances, other habit forming drugs, or alcohol or other chemical substances to an extent that impairs the ability to practice. And a student shall not have that impairment of the ability to practice according to acceptable and prevailing standards of safe nursing care because of the use of drugs, alcohol, or other chemical substances. So at a previous talk that I did on this, we did have a student who had a medical marijuana card. And one of her questions was, is she going to be able to get a job as a nurse? I did not realize that she was in the audience until afterwards. And she said, oh, wow, that put a whole new, it gave her a whole new perspective on things. So, all right, let's talk a little bit about federal legislation as we wrap this up here, and then we will have time for questions. So something changes, I swear, every day when we're talking about legislation, both state and federal, about marijuana and medical marijuana. So about a year ago, a little over a year ago, April, May 2024. The federal government announced plans to reclassify marijuana from Schedule 1 to Schedule 3 under the Controlled Substances Act. Okay. And the DEA and the DOJ, the Department of Justice, issued a statement. And they said that this change was consistent with the view of the Department of Health and Human Services that marijuana has a currently accepted medical use, as well as HHS's views about marijuana's abuse potential and level of physical or psychological dependence. So basically, they were saying, yeah, it's got a medical use, but it can have physical and psychological dependence. Therefore, we're not just going to release it. Okay, we got to control it in some way. That's basically what they were saying there. So then December of last year, we actually began formal hearings. This is at the federal level about the proposed rescheduling of marijuana. Those hearings have been closed now. And so we're just kind of waiting to hear. Okay, so what does this mean? Nothing. That's what it means. Okay, that particular one, that means nothing. You'll need a prescription, which will need to be filled at a pharmacy. So if you substitute Tylenol with codeine for the word marijuana, that's what it'll be. Okay. Dispensaries aren't pharmacies. And so your dispensaries getting the medical marijuana at a dispensary will still be illegal federally. So the way we are currently doing it in Ohio is still going to be illegal federally if that is what happens on a federal basis. Okay. Now, in April, um, there were two bills that were introduced in the federal Congress. Okay, and so they have strengthening this 10th Amendment through entrusting states. That is the States 2.0 Act. Okay, and that would change the Controlled Substance Act. And the goal it was here to remove criminal penalties for cannabis activities that are legal under state or tribal marijuana regulations. Basically, this one is saying, you know what? Let's just let the states decide. Okay, that's what this particular act would do. It would say we're not going to regulate it. We're not regulating it anymore. Whatever that state decides, whatever Ohio decides, whatever California decides, that's going to be the rule. Okay, so if it's legal and if you were arrested in Ohio, or well, you wouldn't be, right? But if you were arrested in a state where it's not legal, and then okay, then that's it. Then that's the determination. Then there's another one, preparing regulators effectively for a post-prohibition adult use regulated environment. That's the Prepare Act. This was another bill that was introduced. And this actually, it's the goal here is to, it calls on the Attorney General, the federal Attorney General, to develop plans to legalize marijuana, cannabis at the federal level. And they direct it, what it does is it directs the Attorney General's office to form a commission to create a plan to regulate it like alcohol. Okay, that's a big difference. There's a big difference between that and saying that it's a controlled substance. Okay, and so what they are doing, what the Prepare Act do, and this was a bipartisan bill. It does have a lot of support. It's currently in committee in the House of Representatives. But they're to consider the impact of the criminalization of cannabis, including the effects on minority, veteran, and low-income communities. And the commission would be responsible for investigating lack of consistent regulation about product safety, including how it affects children, um, and challenges to um, basically challenges for people who were using it for non-recreational purposes. Okay, so a lot of our veterans are we have a very large percentage of veterans with PTS who are using this, for example. And so the idea here is this one here, the Prepare Act, is kind of gonna be like what we do for alcohol, right? And that's a lot, like I said, that's a lot different from the DEA's proposal, DEA and DOJ, which is that it be a controlled substance that you got to get from a pharmacy. Okay. So, lots of information there. That's where we are with it. Now, there are some resources available. And Megan, maybe we can put these in the chat or send them out with the follow up or something. There is a American Cannabis Nurse Association. So that's a new nurses association, and I've got the link there, and we'll send that out. Or actually, I no, I can't put it in the chat.
I'll
I'm
get
not
them
sure
all
if I can.
sent out with the follow-up email.
Perfect. Thank you.
Yeah.
So this is a growing community. There's not a lot here yet, but it is there. And it is about people who are seeing it a lot, who are and remember this is nationwide, right? And so Ohio probably doesn't have a real strong showing in this particular association. But in 2023, the American Nurses Association officially recognized cannabis nursing practice as a specialty area. And then they published this book, Cannabis Nursing Scope and Standards of Practice. I did not purchase the book because it was like $60. So that's a picture of it that I found online. But they have published standards of practice just last year on cannabis nursing. And so that's, you know, in other states, that is big, right? We also have some guidance from the National Council of State Boards of Nursing. And so, for those of you who aren't aware, this is who does the NCLEX. And what they have said, and they put these guidelines out 7 years ago. Okay. And basically, they said that there is clinical evidence that supports the use of cannabis, of medical marijuana for medical conditions. And that there are qualifying conditions, though, that we don't have clinical evidence for. Okay. Some of the things that can influence treatment decisions, physiologic effects of cannabis. We talked about those. Okay. Adjunctive use with opiates, antidepressants, and benzos. Remember, our pharmacists are not checking for interactions. Okay. So that is something because it doesn't come from them. And that may be one benefit to making it a Schedule 3 drug, is that at that point the pharmacy would be able to check for interactions, right? We do have neuro symptoms. And then we also are looking at, when we're talking about spasticity and pain, are we looking at that evidence? And this is just one of the things that they say to look at. Are we looking subjectively? We looking objectively? What kind of evidence do we have there? Okay. They do want medical marijuana education in pre-licensure and APRN nursing programs. And there is they do have a potential APRN certification of medical marijuana qualifying conditions. Again, not in Ohio. Okay, this is a national organization. So, but those are places where you can find more information, and just that are, reputable sources that you can find more information of. All right. And that was it. I will stop sharing. And we have 7 minutes for questions. Why are minorities included with veterans in the Prepared Act? That's because historically we have seen a disproportionate effect on minorities with the criminalization of marijuana. We see many more people who are arrested for its use in the minority populations. That's exactly so, and they're trying to kind of fix that. So, other questions? Nobody else questions. Well,
You must have answered them all.
I must have answered them all.
Uh-huh. You just covered
Exactly.
everything, so they don't have any questions.
I will mention I will mention some of the questions that I got the first time I did this talk. I did include in here because they came up. And one of the questions that I didn't address was whether it was my personal opinion actually was whether marijuana was a gateway drug. Because that had, a lot of people are, they asked me that whether I thought it was a gateway drug, and I said no, absolutely not. Because if you look at the percentages, if you look at the percentages of people who admit to recreational marijuana use, it's incredibly high. The percentage of people who are recreationally using marijuana, or even medically using marijuana, and the percentages of those people who go on to use other drugs, it's actually really small. So I don't think it's a gateway drug. That's my personal opinion. So
I do have one quick question.
yeah.
Um, I used to get a massage about every 2 weeks for some arthritis issues,
Hmm.
and they wanted to use CBD oil on me,
Hmm.
and I was afraid that would show up in my urine. Not that I'm employed in a place where that's happening, but
Yeah.
can that happen? And how long after someone uses any form of marijuana would you expect to see it in the urine?
So it can be in the urine with somebody who is a habitual user. It can be in the urine for up to about a week. But the urine test, which of course is how we all test for it, right? But the urine, it actually goes out of fairly quickly. It's the hair. It can be in your hair for a month to several months if you're a habitual user. CBD oil is not regulated. CBD oil that they use topically, it is not going to show up. That is not what they test for. They test for THC. So it's a different formulary or formulation. So
Thank you
uh,
for clearing that up.
yeah, absolutely. Since most nursing facilities are federally funding, I'm assuming it is also not in use there. Correct. So anybody that's federally funded, they're not going to, they don't want to lose their federal funding. So, how do you address a patient you believe has cannabis use disorder? I think we would address that the same way we do any substance use disorder. And there are very valid instruments that we can assess. Where we can assess patients for substance abuse. And I'm not sure if we have. I don't think that they would need to be modified for cannabis, but some of the questions that show up on some of those are: have you ever felt that your use of it was too extreme, or has anybody ever told you that you use too much? And we do that for all substance use. And so we would use it the same way. Will oral CBD show up in the urine? They're not checking for CBD. They check for THC. So that is when you do a urine drug screen, when that prints out, it says THC. So CBD is it's a different compound, and that's why I mean you can buy CBD on Amazon. So it is there. You can't buy THC on Amazon. Not that I looked, but I have purchased CBD for my dog. Um, yeah, you can buy it on Amazon. So, did the nurse who's accused of using marijuana found on a random drug test or because of an error or policy issue? Um, what nurse that was accused? They found it on random drug tests, but they've also found them when somebody suspected that they were impaired. So we've got both, both types. So nurses who were randomly drug screened, which you know that I swear they're never really random. We all feel that way, right? But we also have had nurses that, because we have a duty to report the suspicion of impairment, right? If we suspect one of our fellow nurses is impaired, we have to report that. And so that is what happened with some of those nurses that have been disciplined. Okay. I see a lot of familiar a lot of familiar people here, like
Thank you so
Tierney
much.
and Diana, Linda LaCharity. It's been a long time since I've seen your face. Yeah.
Okay, well, thank you so much, Lori, and thank you everyone for joining. We will send out two emails after this. One is going to go to everyone that was registered. That's going to include the link to the recording. The other email that's going to go out is to all of you who attended. That's going to have your survey in it. You have to complete the survey to get the certificate that has your CEU credit on it. So I recorded everyone that's here, but there were a couple of Zoom names that I couldn't quite pick out who that was. So if you do not get the survey email, just respond to my recording email and let me know that you were attended, and I will get you that survey email. You can expect your certificates around 48 hours. If it's a weekend, expect them a couple of days later from when you complete the survey. So if you need anything, have any questions, you all have my email and feel free to reach out. I'm happy to help. So thank you all. Have a good rest of the day.
Thanks, everybody.
Thank you all.
Thanks, Lori. Have a great day.
You too.